name is Mohammed Kashif. I'm a final year medical student from batch 2018. So I'm not very doing jokes, so I will not make any. But my life is better. I selected this topic, medical ethics, internship within 3 months in different hospitals across the world. So the hospital life is completely different than the university life. So it should be better if we know the medical ethics to save us from the embarrassment, and we should know the simple and common things about the hospital life, which will make us a better physician. So let's begin. Okay, as in this slide you can see a weight mass. One side is the medical knowledge and the other side is medical ethics, which means the medical ethics is equally important to the medical knowledge. So we cannot take like medical ethics. I will start with quoting Porter Stewart, who was the former Chief Justice of Supreme Court of the USA. He said, ethics is knowing the difference between what you have a right to do and what is right to do. If you understand these two lines, maybe I don't have to give much for the presentation, but I will think because I work on it. So, what is ethics? According to WHO, ethics is concerned with moral principles, values, and standards of conduct. What is medical ethics? It deals with a moral issue in medical practice. So, let's see. Why medical ethics is important? Respect for a patient, informed consent, and confidentiality are the basics to the physician and patient relationship. It is important for physicians' interaction with the society and his colleagues. It is also very important to recognize the difficult situations you have to face in the hospital. So if you know what is right, what is not right to do, it's very easy to take a simple decision in a rational. The principles of medical ethics. Basically, there are 4 pillars of medical ethics. We can remember or remind them with 5 alphabets of ABC. A for autonomy, power of the patient, means the final decision-making power is in the hand of the patient. Beneficency, from B, we have from beneficence, routine. So you have to deal your patient with kindness. C for confidentiality, for secrets. E for do not harm. E for equity or justice. So that is the first one. For example, as a physician, it's our moral duty to tell each and everything about the patient, all the risks, all the benefits, and with all truth and faithful to his commitment, and let the patient decide what is right for him. For example, stop the medications which is harmful or which is proved to be harmful or no effect or something like that. So means first, do not harm. If you are not sure about anything, leave it, let it go, but not harm the patient. Equity or justice. We have to treat the patient as an individual with fair and equal sources we have. We cannot differentiate the individuals or patients. So fair and equal distribution of health resources is very important in the society. Okay, what is informed consent? We usually think that it is just a piece of a paper with a signature of the patient. No, it is not. If you think that the patient just signed the consent and you can do anything on the patient, no, it's not. That's not right. There are some important points of the consent, informed consent. For the disclosure, first of all, you have to tell each and everything what you know about the patient to the patient. Understanding, after you tell him, he should understand. And for example, if you are just telling your patient, hey, you have a dyspnea, he says, what is dyspnea? He should understand. you should not use the medical terms accordingly. You have to see the patient. Capacity. The patient should have a capacity to make decisions. He should not be psychologically ill, or he's mature enough to make decisions. Voluntariness. So he should not have any burden or force to make a decision. He should be free to make his decisions, what he wants to make his decisions. That's important for informed consent. What are the exceptions? We can remind or remember them in the word white. It is an exception. It's usually not common in a daily life hospital. But why work? For example, sometimes situation will happen maybe that the patient said he surrenders his right of consent. It's very rare, but it's possible. Legally incompetent, if the patient is, for example, psychologically ill, they will not respect as well. Okay, use the generic name of the drugs always. For example, the different drugs are sold under the name of different brand name across the world. I remember one thing, once my friend, he was asking me in COVID-19, brother, I have a headache, can I take Napa? I said, what? Can I take Napa? He was from actually Bangladesh. So I said, I don't know what is Napa, I don't take it, brother. So then after that I go to the Google and just write Napa. And I come out there, find out that it's a paracetamol. So like that. So highest quality assurance in patient here. Exposure of unethical content. For example, if your colleague or your fellow physician is doing something unethically, as a physician, it's our responsibility to first of all tell him, brother, this is not good. Try to convince him to not to do any unethical thing. But if it fails, you have to expose him because it may harm the patient and he may harm himself. So you are doing good for him. So if you should not have any financial interest with the patient. If you have the patient you have financial interest with him. So discharge the case. You should not do that because in the countries like Western countries, like America especially, you can be sued and your license will be severe damage and your reputation as well. So as a physician, we should aware of laws of different countries because different countries have different laws. So if the country you are going to do internship or fellowship, you should know or you should be aware of the laws of that country. Okay, misconduct. Insult your license, your whole life, our whole life will be impeded and we can go to jail as well. Okay, Hippocratic Oath. This is one of the oldest document in the medical history. From the 5th century, every medical student sworn in the medical school or hospital is taking this oath. So it is very important medically, and we are bound to this oath, Hippocratic Oath, and there are different points in it and different promises you take with yourself, with God, that you will take care of this noble profession and the responsibilities, because with high responsibilities, with high power, high responsibilities come. So these are my references. So these are the important medical ethics points. So